No, it's interesting that you mentioned lean, though, because of course that's the Bible that we tend to follow with the early stage startups that we work with, which is build, measure, learn. But the idea is to reduce the waste in finding the right product market fit. So prioritizing things like validated learning. Are you on the right path? And that was an eye opener for me, to be honest, in my first startup 13 years ago. But what I've discovered in focusing in healthcare is that lean has taken on a similar origin, but a little bit of a different manifestation in terms of process. So still reduce waste, but instead of reducing waste in what you prioritize for a startup, it's reducing waste within a health system and things like, okay, how long do people have to wait between in the office or between visits and referral times and things like that. Have you encountered that personally much at all? Like these different versions of lean?
Oh yeah, absolutely. I mean, first of all, you've got lean methodology and just the startup world, like you mentioned. Build, test, get your MVP out there as fast as possible, and then try and break the whole thing as quickly as possible. What's cool in healthcare right now is I think a lot of people are approaching the whole system as a waste. Meaning, like, I'm working with a lady right now and helping her pitch her company better. And, like, she's reducing an entire building with an app, theoretically,
Wow.
right? Like, that's crazy, right? She could,
Right.
unfortunately, remove like 100 jobs with an app. And that's amazing.
Right. No, that is amazing. And it's so, yeah, that's the dichotomy that as I've been getting into lean for healthcare to deal with, which is there's kind of two motivations that it could be, which is reducing waste as in time spent on task and people, or it could be reducing waste to the end of better outcomes to the patient. I can't remember who had the quote, but they said that a successful lean transformation within a health system was when everyone in that health system asks, how does this benefit the patient? Which would be awesome if in practice it's actually a guiding force.
Totally. I totally agree. I mean, like in this case, I think that at least in her pitch, it's like 20 steps for the patient to get seen in this whole thing. Or she's in the transfer space. And in her thing, it could talk to maybe 2 people versus, I think, at least this 20. And that's incredible.
Yeah, no, that is amazing. Yeah, and I think that's one of those cases where the incentives align, right? So less work for people within the health system, which of course they're overburdened in so many ways. And then less time spent waiting for the consumer, for the patient. That's great.
Yep.